Dr. Rasya Dixit from Dr. Dixit Cosmetic Dermatology. Sun sensitivity is something that a lot of people complain about, and what they mean could be different things. Some of us, when we go out in the sun, get a lot of redness on the face, on the sun exposed areas. Some of us could be experiencing a solar urticaria. So when you go in the sun, there might be wheals or urticaria or hives forming on the exposed area, and some of us may be actually having a polymorphous skin light eruption where the skin develops reddish marks or bumps on the skin after sun exposure. So when there is a wide range of problems which are called sun sensitivity, let us look at some broad outlines by which dermatologists like to treat sun sensitivity. First and foremost it's very simple, sun avoidance. This means that you have to avoid the sun exposure between the peak hours of exposure, between 11 in the morning to 4 in the evening. So if you have any outdoor activities, try to complete them before 11 or postpone them after 4. The other thing to do is to wear good sun protection, by which I mean not just the sunscreen, I will come to that, but also using of wide brimmed hat, full sleeved clothing, full trousers, as well as eyeglasses to prevent any sun exposure to the affected areas. Using a scarf also may be a good idea to keep your hair covered, because the hair also gets damaged by the sun. The third thing is, of course, to use a good broad spectrum sunscreen with a minimum SPF of 50. Remember that your sunscreen has to be reapplied at least once every 3 hours, and just before you step out in the sun, you should apply it for at least 30 minutes so it can give you the effect that it desires. The other thing is that to also improve the amount of bioflavonoids that you're consuming. Foods which are rich in bioflavonoids are spinach, methi, and these green leafy vegetables actually protect your skin. Other foods, which are the yellow vegetables, contain carotenoids and lycopenes, which are also sun protective. Your doctors may prescribe some vitamins which are containing these vitamins as well, like pycnogenol, carotenes and lycopenes. And these supplements, when taken at least for 3 to 6 months, help to develop a resistance to the sun. But remember, you may also need additional treatment to remove the scars or the pigmentation which has been caused by the sun damage. Speak to your dermatologist to understand more about your skin sensitivity.